Hello, my name is Rachel Smith-Steinert, and today I'm going to talk about infant mortality in Cincinnati. We are going to use this I thought diagram to explain this complicated issue of infant mortality in Cincinnati. Infant mortality is defined as the death of a baby before its first birthday. It is overall a system health indicator because it reflects on the health of women and men of childbearing age, the health of pregnant women, and the health of children. Causes and risks of infant death can be prematurity, congenital anomalies, SIDS, smoking, drinking during pregnancy, poverty of the mother, and spacing between births. 70% of the 2013 infant deaths in Cincinnati were related to prematurity. Women who continue to smoke during pregnancy are 44% more likely to experience an infant death, and women who enter pregnancy obese are 48% more likely to have an infant death. Women with pregnancy spaced less than 18 months apart are 368% more likely to have an infant death. When looking at the current state of the issue in Cincinnati, there are a number of factors to consider. Currently, there is no specific legislation in Cincinnati that is pending, but there is health policy being created on the state and national level that we will discuss. In the United States, approximately 6.1 out of 1,000 infant deaths occur each year. In Hamilton County, this rate is 9.9 out of 1,000. In Cincinnati, it's 12.4, double the rate of the United States. In 2011, Ohio's infant mortality rate was the fifth worst in the country. Among African Americans, it was the very worst in the United States. In the past 5 years, 543 babies have died in Hamilton County, which is approximately one death every 3 days in Cincinnati. Premature babies' medical costs average 12 times that of term babies. Cincinnati as a city spends more than $80 million per year on preemie care. When looking at women in Cincinnati, they struggle with higher rates of obesity, sexually transmitted diseases, drug abuse, poverty, and stress when compared to the national averages. Pregnant women in Cincinnati have higher rates of hypertension, gestational diabetes, which leads to preterm births than their national counterparts. In the first year of life, babies in Cincinnati die in their sleep at 3 times the national average. Mothers in Cincinnati are less likely to breastfeed, less likely to receive a postpartum checkup, and more likely to suffer from postpartum depression. When examining Cincinnati's infant mortality, we must also look at the obstacles that exist to improving infant mortality rates. First, as we discussed, infant mortality is an indicator of general health. A community's infant mortality rate is a reflection of overall health, because the most vulnerable citizens are dying at alarming rates. Our infant mortality rates also show us that there is extreme racial inequality that exists in Cincinnati. The prematurity rate for African Americans is 69% higher than that of Caucasians in Cincinnati. When looking at Ohio, black infants die at 2.5 times the rate of white infants. And we must also look at general women's health. Since over half of pregnancies in Cincinnati are unplanned, improving women's health during pregnancy is dependent on improving women's health overall. When looking at infant mortality in Cincinnati, we also need to examine resistance to improving this health condition. Initially, neighboring community hospitals were reticent to work together. These hospitals are all competing for maternity and pediatric inpatient dollars. But once the issue was explained and the grave facts were explained, hospital leaders came together. Currently, a consortium comprised of UC Health, Mercy Health Partners, Children's Hospital, and TriHealth are all working together to promote safe sleep of infants, decrease smoking during pregnancy, and spacing births more than 18 months apart. The support that lies within Cincinnati to decrease its infant mortality rate is growing. Two key organizations that have been started are the formation of Cradle Cincinnati and the Strong Start Avondale project, which is focusing on one of the hardest hit neighborhoods, Avondale. State Senators Shannon Jones and Charlita Tavris are drafting bills in the Ohio State Senate to combat the problem. On December 19, 2014, State Bill 276 was signed into law, increasing funding for safe sleep education and ensuring free cribs to pregnant women. Sherrod Brown, a U.S. congressman from Ohio, introduced legislation which enhances research and awareness surrounding SIDS. This bill was signed into law by President Barack Obama December 18, 2014. Safe Sleep Cincinnati is encouraging infants sleeping alone on their backs and in cribs and has started a billboard campaign in Cincinnati. The Perinatal Community Action Team and the Ohio Equity Institute is also looking at real-time data surveillance and is aimed at reducing racial inequalities in birth outcomes. One of the greatest and most powerful coalitions formed to combat Cincinnati's high infant mortality rate is Cradle Cincinnati. Cradle Cincinnati's goal is to see every infant born in Hamilton County survive their first year. By June 2014, $1.3 million had been raised to address pregnancy health. Cradle Cincinnati is a partnership between Hamilton County, the City of Cincinnati, Cincinnati Children's Hospital, UC Health, Mercy Health, Tri-Health, the Christ Hospital, the United Way of Cincinnati, and the Cincinnati Health Department, and the UC College of Nursing to combat high infant mortality rates in Cincinnati. The three primary drives that have been identified by this group, which affect local infants, are pregnancy spacing, smoking, and sleep-related deaths. These three areas are where Cradle Cincinnati are focusing their efforts this year. Both Vice Mayor Mann and Ryan Adcock are very receptive to the ideas surrounding infant mortality. Vice Mayor David Mann used this issue as part of his platform when running for office in 2013. When reflecting on the meeting that I had with these two individuals, I felt that it was very successful. Mr. Adcock and Vice Mayor Mann were very informative. We discussed for 30 minutes the issues that are affecting our city. They were able to answer questions and offer new insight on the obstacles, resistance, and support surrounding the issue. I did a lot of research before meeting with these individuals, which helped our dialogue. This meeting made me want to get more involved in an issue that I feel passionate about and that I know Cincinnati can improve. It was very inspiring to see all the work currently being done in Cincinnati. Some issues that I discussed with Vice Mayor Mann and Mr. Adcock were my action plan to address some of the obstacles and increase support in Cincinnati. Overall, I see that along with improving health, we as a society and city must also provide greater access to prenatal insurance, food and formula for infants when they are born, shelter for pregnant mothers, in-home newborn care, and early childhood development education. We also must improve utilization of health services and improve social conditions for high-risk pregnant women. We must improve access to early prenatal care, which focuses on smoking cessation, the importance of nutrition, and stress reduction. I think it's important for Cincinnati to identify key community figures in largely affected communities, such as Avondale, Price Hill, and Walnut Hills. I think it's important also to utilize churches in these areas for outreach. Church officials are often trusted individuals in their community and could be key figures to deliver health information. I think it's also important to approach local businesses, such as Kroger, Frisch's, Procter & Gamble, and General Electric, for fundraising for public health announcements on television, radio, billboards concerning infant sleep and prenatal care. We could also utilize services such as WIC to distribute literature on safe sleep and smoking around your baby. After researching the issue of infant mortality in Cincinnati and meeting with Vice Mayor Mann and Mr. Adcock, my position statement is, with community support from both the public and private sectors, each possible factor that increases infant mortality can be combated. With increased funding and education, infant mortality can be decreased in Cincinnati, improving the health of our community overall. As Wendell Young, co-chair of Cradle Cincinnati and a Cincinnati City Council member, stated, "We cannot continue to accept a society where your zip code or the color of your skin dictates whether your child will live to see their first birthday."